with Dr. Patrick Oliver, a leading voice from Mind Peace Clinics, an organization that is at the
This
forefront
meeting is
of
being recorded.
of mental health treatment, particularly for those facing treatment-resistant mood disorders. Dr. Oliver, thank you so much for being here. Really appreciate it.
My pleasure.
Dr. Oliver, Mind Peace Clinics was founded in 2017, and this was stemming from a deep understanding of the frustrations with traditional mental health treatments. Can you tell us a little bit about that initial vision and what inspired the creation of Mind Peace Clinics?
Sure. I was working in an emergency department here in Virginia, somewhere around 2015, um, and a beautiful crisp fall morning. And long story short is a patient came in as an alpha trauma shooting, which is a little bit odd at 8:30 in the morning. But this lady walked out to her shed and she'd been suffering with depression and suicidal ideation for years and tried multiple different conventional treatments and therapies, and nothing seemed to work for her, which is tragically a very common, um, what is it, common, occurrence. And unfortunately, she was basically dead upon arrival to the emergency department. And I wasn't able to convince her husband to donate her organs because, his whole world had just shattered, which is completely understandable. But I basically said to myself at that point in time, if there's anything I can do to fix that, then I will fix it. And I talked to a buddy from college, and his brother was doing this out in Seattle. And I talked to him, and I was very skeptical that he was using ketamine, a 50-year-old anesthetic, to fix people that had, chronically bad mood disorders. And so I flew out to Seattle and met with he and his patients and saw how he was doing it. And we opened up clinics, and right after the American Psychiatric Association put out a consensus statement saying to, um, what is it, saying to, treat mood disorders with ketamine. We opened a clinic in Arlington and then in Richmond and then in Norfolk. So we've been doing this since 2017. We've published once. Within the next month, we will publish again. I think we're going to try for Lancet Psychiatry. And so working with a psychiatrist who trained at Yale to publish our second paper. And, we're just trying to take care of patients.
That's amazing. That truly is amazing. That's a powerful origin story. I mean, and you mentioned the discovering of the success of the ketamine infusion therapy. This is relatively new or maybe misunderstood treatment, I guess, in the mainstream.
Sure.
Now, granted, I'm all for holistic treatments as well. I think that's something that Western medicine does not afford us a lot of the time. But as far as the ketamine infusion therapy, can you explain kind of more what it is and how it works, especially for treatment-resistant mood disorders?
Sure. So the ketamine is fascinating to the extent that it's an anesthetic at high doses and it's been used and studied. It was discovered, if memory serves, in 1962, and it was FDA approved in 1970. So you're talking more than 50 years out. And the simple version is that in the year 2000, there was a very small study done at a little startup school called Yale. Um, and they basically showed that IV ketamine infusion was working to treat people and give relief to people with mood disorders, very specifically depression. There have been several hundred studies since. The one of the ketamine molecules was FDA approved in a nasal spray called S-ketamine. The trade name is Spravato, and it's been approved for depression and depression with suicidal thoughts, and as first line treatment. But we do the old, originally discovered IV method, which works better and lasts longer. And the fascinating thing is about how this medication works. So we use it, to use an alcohol analogy, at kind of the buzz tipsy level. So for not the drunk level, which would put somebody to sleep. We call it partially disassociated with ketamine. You can think of it as being somnolent. And if somebody asks you a question when you first wake up in the morning, um, you basically get to the point of being able to answer, but it takes a couple seconds. So you're present, you're kind of there, but a little bit maybe tape delayed. And what the medication is doing is it's blocking a receptor on the nerves called an NMDA receptor, and it's activating other receptors called AMPA and tyrosine kinase B. The long story short, there's a pathway that it goes through, and it produces something called BDNF, derived naturopathic factor. And when it does that, it basically tells the nerve to regrow branches. So when I think of nerves, I think of trees, and it literally regrows the branches of the trees and makes new connections called synapses. So synaptogenesis. And when it does that, and there's enough connections, it balances two different neurotransmitters, GABA, which is the brake, and glutamate, which is the gas. So it works on a different pair of neurotransmitters than your serotonin, than your dopamine, your norepinephrine, your nicotine, etc. And so it's basically just a different key for the lock. And we've published our data in the Journal of Clinical Psychiatry in September of 22, and we showed basically 80% success rate
Wow.
um, of patients getting between 6 to 10 infusions. So you're talking about, people sometimes down 20, 30, 40 years, tried 20 different meds, and within 2 to 3 weeks, we have them, better. And 40% of people basically have either complete remission or nearly complete remission of all of their symptoms.
Wow, that is truly incredible, and especially some of these patients that I'm sure you've seen that have tried everything under the sun, as far as
100%.
prescriptions too, and then just to switch to this and see results right away is really powerful. It's incredible to hear about the impact that this therapy can have. And Mind Peace clinics. So you started in Arlington, expanded to Richmond and Norfolk. So you're kind of the Virginia area. And are you in Arlington?
I'm in Richmond.
You're in Richmond. Okay. Okay. I mean, and that kind of growth, though, that speaks volumes about the need and effectiveness of the approach, too. And I'm sure the word of mouth has helped kind of grow the Mind Peace clinics. And what has that expansion been like? And what drove that decision to open new locations? Was it the growth? Was there other factors as well?
Well, we were pretty much first to the market to be able to, I mean, we were very early.
Hmm.
I was probably uh, between number 25 and number 50 for the people in the United States doing this.
Wow. Okay.
And in Virginia, I think there was only one other place that was kind of sort of doing this. And one other place in the Washington, D.C. metro area. So we basically just opened up where the need was. We opened up in basically Arlington, just outside of DC. When we did that, then we went to Richmond because we were getting as many calls from Richmond as we were in DC. And driving an hour and a half is a little less than ideal for a medical treatment. I mean, if
Hmm.
necessary, that's fine. But we wanted to be relatively conveniently located. And then we added Norfolk as well in 2020 at the beginning of COVID.
Okay. Okay. Did COVID have any impact on this? That you saw?
Yeah, I mean, I mean, I don't mean to be trite, but all of the psychiatrists and most of the mental health professionals, they went home and they got a Zoom account and they put on their bunny slippers, and they haven't been seen in the office since. And so it's tough to get access to, mental
Yeah.
health professionals. And, even if you're a physician or in, the industry, as it were, quote unquote, I mean, it can still take you 2 months to get, an initial meeting with a psychiatrist, even if you're suicidal. They'll send you to the emergency department. You may be admitted for 72 hours. But I mean, unfortunately, it's a temporary measure and it's not a definitive treatment. And so what we've done is we did definitive treatment and we try to get patients in within 7 days. And and because, we get calls, and I got calls today, multiple people being suicidal and at their wits' end and frustrated and fragile and not sure what to do. And, that's what we do. And the numbers for suicidal ideation, which is one of the thing that I'm most passionate about from the story of starting, is
Hmm.
we published our data, and we're publishing again, um, up to 85% resolution of suicidal ideation, as in those
Hmm.
thoughts just go away. So we are very proud that, we're taking care of so many patients in that situation, which is the only known uh, FDA approved medication that actually treats suicidal patients.
Yeah, yeah. I mean, and that's the key here. And I mean, you see it. I see it. I mean, I'm local in Chicago.
Hmm.
I feel like the mental health, and I don't have like, data to back it up on me, but from what I've seen, out in the world, it seems that, um, mental health has not necessarily gotten better
Yeah,
over the course of, especially since COVID. With everything going on in the world. And I think that that was really a trigger point to, a lot of other patients needing help. And yeah, you just
sure.
described the process of it. If you do have suicidal ideations, like what do you do? They just send you to the emergency room. That maybe they prescribe you to something, and it really is a band-aid instead of going at the root cause of it. And I think that, I mean, that's very valiant, and that's that's great that My Peace Clinics is taking a look at the root cause here, because that's really what it's all about, to everything in the medical field, but especially this, when it's fairly urgent, right?
Yeah.
And there's emergencies. And I mean, so since 2017, I did a little research here. My Peace Clinics has treated over, and I just want to confirm these numbers with you too. 1,000 patients, completed over 10,000 infusions. Does that sound about right? Those are
So
pretty
those
remarkable numbers.
those numbers were from a couple of years ago, but that's what we're looking to publish now, because it takes a little bit of time to publish. But I mean,
Okay,
we're closer
okay.
to treating 2,000 patients, more than 20,000 infusions.
Wow. So
So
double that.
this is all we do, and just one
Yeah,
patient at a time, and we're having very good success.
right. No, that's great. I mean, that's remarkable, those numbers. And what would you say as far as like the patient impact on an individual level? And obviously, no names, but what are some of the most profound transformations that you've witnessed in patients who have undergone this treatment? And it could be from a personality level, from a recovery. What are some of the most profound transformations that you've seen personally?
I mean, it's everything from people getting their lives back. I mean, it could be that a patient who was bedbound can now shower,
Yep.
without me Herculean effort. We've had multiple patients who were, in college and were so depressed they couldn't go to classes. They essentially failed out or took medical leave or what have you. They'd gone back to college. They have finished their studies. They have gotten jobs. I mean, I had one patient that is coming to mind, and he was suicidal at a, college here in Virginia. His dad was going up virtual every night because, to sleep on his son's floor, as basically a suicide watch. And 6, 7 infusions later, he's fine. He's going to law school. He's got a girlfriend. His folks are thrilled. I mean, it's just a complete resolution. So, I mean, we have like stories of that like literally every day. And when you do this, even the a physician that I work with, Dr. Leary, who also works in the emergency department, he basically says that this is the most rewarding element of his medical practice of 15 plus years. And he basically said, this, we're just really impacting people's lives. And especially when you take somebody from being suicidal with a plan and a date, and you basically, have them transition the thinking to, okay, what am I going to do? And I kind of want to get a girlfriend, and I need to work on this relationship. Like, you have them start living again. And whether that's taking out the trash, and then kind of no big deal, or going out to eat with a friend, or a Marine going to a gun range, it's living. And, these, patients are in a very rough spot. the conventional treatments often don't work,
Mhm.
and this does. And it's just a different key for the lock. And, regrowing connections in the brain. I mean, you're talking about an evolutionary change in the way we practice interventional psychiatry.
It really is amazing, and that's the word I think that I kept thinking about. From our call last week to this conversation is rewarding. Because how
Sure,
rewarding. I mean, this is the ultimate reward to basically save patients, for lack of a better term. I mean, when
sure,
you're looking at the patients who have a plan, a concrete plan to do it, and like they probably told you about it, and then they're exiting your clinic and now they're starting to think about real life things of like, okay, I'm going to continue on here and I'm looking forward to certain things about life. And because life, as we all know, can be very stressful. And I think that there's
sure.
obviously external factors, internal factors that shape all of our experiences. But I think that the work you're doing, it seems extremely rewarding, and I'm glad that you agree, and that this
Yeah.
is it really is remarkable. Now, I guess beyond the numbers, just to this point, Mind Peace Clinics emphasizes core values, service to patients, health and safety, and providing, that platinum standard of care that is truly rewarding. And how would you say these values translate into the daily operations, the patient experience at the clinic?
Well, I mean, we don't have a corporate structure. We have physicians who are leading this practice. We
Mhm.
have registered nurses who are present the entire day, for all and every infusion. And so, as opposed to, solely a profit motive, I mean, we just structured everything around taking care of patients. And we took the administrative bureaucracy out of the equation. And when you do that, you can just focus on the patients. And whether it being like, hey, they get to have a Sprite and we provide, some creature comforts when they come in, eye masks, weighted blankets, a white noise machine, headphones, etc. We just try to take good care of the patient. We don't have people packed in. It's not like you're, with a often what I hear from psychiatry visits are like people have 15 minutes, and when the 15 minutes is done, then your time is up. I mean, our patients stay for an hour and a half. And if they need to stay another 10, 15 minutes, no problem. I mean, when it gets to be 2 or 3 hours later, you're like, okay, maybe it's
Right,
time for you to progress about your day.
right,
But I
right.
mean, we can, structure our entire office and our entire practice around, the patients and caring for the patients and, being as there for them as, they would like their physicians to be.
No, and that's great to be able to have that authority to shape the workflow, and to not have, yeah, the unnecessary administrative forces in play as well. I mean, I've seen every type of clinic, whether it's locally, it's Northwestern, it's Advocate,
Sure,
those big
sure,
IDNs,
sure.
Endeavor, and obviously, I'm in medical sales. I've been doing it for 12 years. I've seen a bunch of different specialties from ortho to ENT to radiology to urology, radiation oncology, anesthesia, and so I've seen, how some of these clinics work, and you do have the busier ones, especially. I mean, they try to cycle in patients as soon as they possibly can. You're not actually seeing the main MD, until probably 45 minutes after you're there, and they see you for 5 minutes, and they got to go on to the next one. And that's just the
Yeah,
way it's shaped, and that's just,
sure.
the you can't really have bedside manner in that regard. So,
No.
I mean, to have that personalized experience, and obviously, with something like this, the nature of it is different, but it's still really cool to be able to see that and to hear about it, right? So, I guess as far as the future goes, looking ahead, what would you say? Um, what's next for Mind Peace Clinics, and are there new research areas, expansions, or any other initiatives that you're working on that you're excited about?
We're very excited on publishing our second paper. Like we mentioned earlier, over a
Yep.
thousand patients, over 10,000 infusions. One of the critiques for several years was how do outpatient clinics perform? And we published our initial data. And with over 1,000 patients, I mean, it's starting to be data with sufficient numbers to very much demonstrate clinically through papers
Hmm.
um, how patients are doing and the result of what we do and how we do it. I think as a generalization, interventional psychiatry is going to become more and more a thing, and that's including transcranial magnetic stimulation, electroconvulsive therapy. I think that you're probably going to see in the next 5 to 10 years, if not before, psychedelics like mushrooms,
Hmm.
psilocybin, ibogaine, um, ibogaine rather, and LSD even being used, to basically literally change people's minds.
Hmm.
Um, and so when you do that, and when you have the realization that this is a physiologic fix, um, I think that, some of the stigma that's surrounding uh, depression and suicidality specifically, and even generalized anxiety, when we have a fix for those things, I think this stigma starts going away because we have a better understanding of what these disease processes actually are. And that, if you break up with a girlfriend or a boyfriend or a divorce or, whatever, talking to a counselor can be very helpful. But if you have a physiologic problem in the brain, as I tell some patients, I was like, you can have the nicest Porsche in the parking lot, but if the wires aren't connected, it won't be moving. And so we reconnect the wires. And I think when people start to understand that these issues are physiologic, not necessarily just psychologic, I think that that's going to be an evolution of treatment for people with mood disorders that will literally start, if not curing them, definitely putting them in remission, and many patients for an extended period of time.
Oh, absolutely. And that's, I mean, the LSD component, and just thinking outside the box for other ways to, like you said, change patients' minds,
Yeah.
about, and instead of like a black, a lot of these times, I mean, for lack of a better term, it seems like a lot of these patients just don't, they're not looking to the future because the now is so difficult that they can't
Hmm.
even like look, they can't even see whether it's tomorrow or next month or next year. That's like, doesn't even register. It's like right now I'm in so much pain, and and getting them to start thinking about, hey, actually, you not only do you have a future, but it could be bright, actually, believe it or not. And
Yeah.
so to just to get the human mind and the psychology, it really is very it's very interesting as far as kind of how that works. And I'm sure with the work that you've done over the past decade, you've seen that, right? You've probably seen these moments when the light comes on for some of these patients, and it's probably,
Yeah.
yeah, in real
Yeah,
time
we,
too,
we we
right?
can literally see their affect change in a matter of days. And I mean,
Yeah.
and oftentimes family members, see it before it. And patients, our patients are often lagging indicators, meaning they will get better before they realize they get better. And I think you touched on it very well. You know, the mood disorders are brutal, because they're some of um, the only diseases that prevent you from fixing them. They rob you of perspective, they rob you of being forward thinking, they rob you of an accurate assessment of your surroundings and life, etc.
Hmm.
And when you fix those things, they just get better.
Hmm.
And I don't want to oversimplify it, but we kind of try to make it look easy because we've taken care of thousands of patients and
Yeah.
we've done tens of thousands of infusions. And when we publish, we're trying to kind of contribute back to the body of knowledge so that we can advance it, and other people can learn from both our mistakes and our failures as well as our successes.
Yeah. Yeah. Which is, I mean, incredibly powerful. And I guess um, one of my last questions here, and then I'll let you go. How do you go about like patient acquisition and any marketing that you might be doing, or how has that worked, and how have you been able to grow your practice, thus far to now expanding from one to three, and doubling what I thought it was, which was that what, 10,000 infusions. It's actually closer to 20. I mean, how have you gone about patient acquisition and retention, and kind of what does that look like for my Peace clinics?
Yeah, so I mean, most patients they do between 6 to 10 initial infusions. We have about 20-ish% of patients who come back for booster infusions at some point in time. And when we do that, I mean, the booster infusions help. But most people, I mean, our goal is to fix people.
Right.
But there's you very astute to say that there's also business to this. And, we have tried multiple different modalities, Google Ads, Facebook Marketplace, advertising, et cetera, and have had very limited success. So ultimately, we have recently hired, a clinic representative to go out and bring brochures and explain to, nurse practitioners and mental health professionals and psychiatrists what we're doing and how we're doing it, et cetera. And it's also, truthfully, the biggest bang for the buck is our Google reviews and our patients who go back to their psychiatrist and
Hmm.
they see them suicidal on the first of the month, and by the 30th of the month, they're fine. And a lot
Yeah.
of psychiatrists, especially after they've been practicing for years, they're like, what just happened? And
Right.
the only thing that changed was the ketamine. And, they go back and they're fine. And, I got a call last month from a psychiatrist, and she's like, oh, well, I thought this is only a temporary fix. And I said, actually, we've had patients go out years
Hmm.
without needing booster infusions. So she's like,
Yeah.
okay. And it's just catching up with the literature, and everybody's busy, and very few people have the ability to keep up on the literature for everything. But so the patients go out and they talk to their friends and their counselors, and, they find us when they go online and look for us.
Yeah. No, and um, I mean, that's a great way to go about it. I think that, this has been an incredibly insightful conversation. Um, I feel like I have so many more questions, but I want to respect your time, and I appreciate you shedding light on the vital, extremely important work that Mind Peace Clinics is doing, offering hope to so many who might not be able to see it themselves. And for anyone who might want to learn more about Mind Peace Clinics or ketamine infusion therapy, where can they find more information? I'm assuming it's on your website.
Yeah, the best way to get it, a quick synopsis, 24 hours a day, 7 days a week, is our website,
Hmm.
mindpeaceclinics.com. And you can also call our office through the number on
Hmm.
mindpeaceclinics.com. And, we will give you on our website a pretty thorough overview. Um, and of just ketamine and how it works, et cetera. And what I will caution you is this is normally an out-of-pocket fee for service because there are no FDA or CMS,
Hmm.
Centers for Medicare and Medicaid Services codes for this, CPT codes.
Right.
So you're normally paying out of pocket for it.
Hmm.
If finances are an issue, you can go for the S-ketamine nasal spray, and that's often covered by insurance. It doesn't work as well. It doesn't
Hmm.
last as long, and it costs 3+ times as much.
Hmm.
But it's definitely a step in the right direction.
Okay, great. Thank you for taking the time to meet today. I think that one more thing that you mentioned that stood out was the fact that you just hired a representative for I guess for outreach purposes, which has
Sure.
shown up in some of the conversations that I've been a part of. And I'm not looking to, I guess, pitch anything, but if you're open to it, I'd be curious to learn a little bit more about that process and kind of what that person is doing. There might be a few ideas or pathways that I have available that I might be able to save time or accelerate some of the patient outreach. Would you be open to having a follow-up chat about that? That's kind of off the record and
Yeah,
just us two.
absolutely. I mean, listen, we're just trying to help as many patients as we can.
Yeah,
A lot of
yeah,
these patients in this patient population has been neglected, and if an SSRI or SNRI or mood stabilizer doesn't work, they'll
right.
try another one. And I mean, as we know, the cliche of the definition of insanity is trying the same thing over
Yep.
and over again with the same results. You know, but we're happy. We just want to get the knowledge out there that this is available, and we want to take care of as many patients as we can, as safely and efficaciously as we can, with compassion.
Yeah, no, of course, of course. That's great. Well, why don't we, I mean, I guess we did last Wednesday this, I mean, we could plan on next Wednesday at 1 o'clock too,
Sure.
if that works. And yeah, so I'll go ahead and I'll send you an invite for that. But thank you so much, Dr. Oliver. This is really cool, what you're doing, and you should be proud. I'm sure you are, and I'm sure your staff is too, because this is the ultimate, care right here that you could provide patients. So
Yeah,
really cool, and I really appreciate it. And I will send you an invitation. We'll go from there.
that sounds great. Thank you so much for your time.
Thank you so much, Dr. Oliver. You have a great day.
Bye now.
Thanks. Bye.